This is Next Steps for Seniors with your host, Wendy Jones. Each week, Wendy brings resources and information to help guide you through those next steps with elderly parents and loved ones. You can follow, subscribe, and share on your favorite podcast platform. If you have questions or topic suggestions for Wendy, you can call us at 248-651-5010 or email at hello@nextstepsforseniors.com.
Hello and welcome to Next Steps for Seniors, Conversations on Aging. I'm your host, Wendy Jones, and as you all know, I like to bring unique, fun topics that people just need to know about because knowledge is power, really. And today is no different. Our topic today is Genesight medication management. And you're probably wondering what Genesight is, why do I need to know this, and how it's going to help me. Well, guess what? We're going to get into that right now because in my studio is Frank Dubois. Hi, Frank. How are you today?
Good morning, Wendy. Good, thanks. Thanks for having me today.
I am so glad you're here. Dubois, what nationality is that?
We're French.
Okay.
I'm only the fourth generation to live here in the U.S., so I changed it from Dubois back in high school in French class because it was getting me in trouble. The instructor looked at me and said, "So, Francois Dubois, and you're calling it Dubois?" I'm like, "Well, not anymore." So I changed it to Dubois. So myself, my kids go by Dubois. And so it's been that way now for 40 years.
There you go. There you go. And he's the senior molecular sales consultant for Genesight.
Yes.
And you've been there for 10 years.
That's 10 years this month.
And people are like, Genesight, what's that?
That happens a lot to us. And we've actually been around now just about 20 years in the market space. And but no doubt the ball is rolling. We just tested in October our 3 millionth patient, Wendy.
Wow. Good
when
for
I joined,
you.
we had a celebration for our millionth. And we've already achieved 3 million since, two additional million since then to total 3 million folks that have been helped with Genesight.
So people who are listening to the program right now who are like, what is Genesight? Mm-hmm. Can you give us like the LOL?
Absolutely.
The basic?
Genesight is a lab test that basically looks at, we're in the market space called pharmacogenomics. So basically you're looking at pharmacology of the medicines, how the medicines work, but specifically for that individual. So that we look at a combination of pharmacogenomics and, pharmacology and genetics, and that then gives the insight to the clinician to have a better selection for medication and very specifically dosing for that medicine as well.
And it's shocking to me, just so we know, the average senior is on 12 to 15 medications a day.
Yes.
A day, many of which may not even be helping at the situation.
No doubt about it. It's polypharmacy is its highest rate with the senior population, and this is one of the things that Genesight allows the clinician to do is maybe limit some of these medication selections and select the medications that are a better match for the body performance-wise at the right dose. So instead of all that trial and error where somebody's trying, this antidepressant or this sleep medication at X dose, this lets the doctor know firsthand how is that person metabolizing on nearly 70 medications in the body day by day to be able to match that and reduce some of that polypharmacy opportunity, but still have the person feel better. So
mental health obviously is on the rise, especially in our older adult population. Mm-hmm. And your organization, Genesight, started back in the day doing mental health, basically.
Oh, absolutely.
Right?
Yeah, the test was originated by a gentleman. His son had taken his own life, and so his name was Don Wright, and so Don looked at this and said, "There's got to be a better way." That poor teenager had been to various doctors, had tried various medicines, could never find the answer. So Don worked with Mayo Clinic and put together an algorithm in place that quickly went to test that looked at, we've got to be more informed on medication and dosing selection to help people in this country.
Well, thank goodness,
yes,
honestly.
I could not agree more. And I've been so proud to work for the company. And we're now publicly owned. We are owned by a group called Myriad Genetics out of Utah. But for years it was private, and Don was the one that really got the ball rolling with Genesight. And
it's a simple blood test.
No, it's actually cheek swab. Cheek swabs, so very, very non-invasive. Yeah, so it's just 2 cheek swabs on the inside of each cheek lining, a rolling 8 to 10 second an 8 to 10 second rolling scrub. That kit gets sent on to our labs in Mason, Ohio, just north of Cincinnati. And the doctor has this data back in approximately 3 days, 3.5 days. It comes back to our portal.
Well, and how simple is that?
Oh, simple as can be. It's easy to the point. We also have, from an office environment, if it's a private practice, we have 14-day life at room temperature as well. So the kit could not be a better setup in terms of ease of use, and then everything gets shipped over FedEx Express, and that test comes back, like I said, in 3 or 4 days. So the return to the office or to the clinician is very, very quick.
Oh, it's just shocking to me. I am so grateful that you are doing this. I honestly am. And it's growing.
Oh, growing substantially. Yeah,
in the last 5 years, tell us how it's opened up. Yeah.
Yeah. Well, to give you a feel, when I joined the company in 2015, like I said, we had that celebration celebrating our millionth patient that was helped. And then by about 2019, we celebrated our 2nd million, and just this year, and COVID really had slowed that down a little bit with everything
I'm
going
shocked.
to I know.
Oh, geez, let me
the
tell
same
you.
story for
it's
everybody.
It slowed the whole world
Yeah.
down, and it's so sad.
Well, actually some good things came out of it as well. We the company fast-tracked a direct-to-patient kit during that time frame, so the person could swab themselves at home if necessary, because everything for some time went to telehealth immediately. But if I could share a story from my family, one of the reasons I joined the company, Wendy, is my daughter was sputtering along in school, and she was not finding the right answer. The pediatrician tried a couple different ADHD meds with her, and they were so activating, she was staying up about 30 to 35 hours activated. So we went back the third time, and the clinician said, "Hey, I don't think this treatment's for her." Sent us home with nothing. Mm-hmm. So we kind of shaking our heads. What do we do? What do we do to try and get her grades up to make it into college? I wound up running into a representative in Novi for Genesight, and we used to work together in pharmaceutical. And so he said, "Hey, Frank." I said, "Hey, Jason." I said, "How you doing?" He said, "Good." He said, "How are the kids?" And I said, "Oh, my daughter's kind of sputtering along in school." He said, "Hey, there's a test for that, right?" He was working for Genesight. I didn't realize that. So he gives me a brochure. I run that back to Fenton to the pediatrician. I wait 90 minutes for him to finish his day. He comes out and he said, "Hey, good news. There's a test for this." He looks at it and said, "The hospital won't let me do this. Too busy." So Jason helped the next day, line me up in Waterford with a doctor that swabbed Lauren the first day. We get the test back. Sure enough, and the medicines are bin like a stoplight, like green, yellow, and red. The 2 she tried were in her red bin. There was only one in her green bin called Vyvanse. Wendy, she took that. Her grades started to accelerate. She gets into Central Michigan on probation, graduates 3.833 in honors 4 years later.
Incredible.
Changed her life.
Absolutely incredible. And this is exactly why you're here today.
Exactly why I'm here. So I called Jason back and said, "Hey, if you guys ever hire, keep me in mind." Not thinking I'd ever really hear anything about it. Sure enough, a couple months later, we got the Medicare approval. They hired for Flint, overhired for Flint and Grand Rapids. I'm the Flint guy.
There you go.
So I always look at it as meant to be. But when offices share with me, I've had doctors say, "Oh, Frank, all my patients succeed. I don't need this." That's when I say, "Hey, can I just share one story with you? Can I tell you about how it changed a family member's life?" Mm-hmm. And usually, hopefully, they'll just give it a shot to help some of their patients at a low cost. On the Medicaid, Medicare platform, it's no cost. So it just could not be a better situation. And for seniors that have so much polypharmacy going on, it can really bring to light a better medicine performance trail along with the dosing strategy that comes with it.
Absolutely. There is no doubt in my mind. And the reality is the simplicity of the test is key.
Yes.
And this is available everywhere.
Everywhere. We're represented in 49 states, Wendy, by sales reps. And like I said, we've been doing this now. This is our 20th year, so it just continues to grow. And more facilities. I call on a lot of the long-term care facilities. A lot of them are shifting to make this protocol because they realize that all it takes
is
because to help reduce, polypharmacy, to help with behaviors, to help them meet some of their guidelines set out by the surveyors in terms of gradual dose reduction planning and the antipsychotic meds. This is then all at your fingertips for the team to make a more informed decision, and again, at no cost. So the facilities look at this because all it takes is if somebody's doing well, I'm not suggesting change a bunch of their medicines, but all it takes for that senior at a facility level especially is a bump to the hospital, and they're going to come back on 2 or 3
Different
new meds, Seroquel or Ativan, all these different mixes, and they're really can be sedated and really on a bad trail. So if we have this in the file ready to go, then at least you could be more proactive instead of reactive.
And this is available to seniors who may be in their home as well, or
Absolutely.
is it only in a doctor's office?
Absolutely. We work with a lot of home care groups. We work with hospice companies because there is a fair amount of anxiety and some depression in that market space. All the different private practices can inquire. If they just inquire on Genesight.com, is GENESIGHT.com. That asks you right off the bat whether you're a physician or a patient that's making an inquiry, and then you just follow the prompts. They'll ask you if you're interested in receiving a call from customer service, or we have an office referral, meaning you would put in your zip code as a patient. It gives you a 50-mile radius of referred offices that are already set up in your area. So it's really easy to do Genesight today, Wendy.
It absolutely is, especially because everybody knows Genesight.com now. That's very easy to follow. And anywhere you are, definitely take an opportunity to go on that site. And if you're saying, why should I do this? I'm going to say, why not?
Why not? And there's some testimonials of how it's changed lives, whether it be depression, bipolar, anxiety, sleep. There's a lot of good things to look at on that site.
You're listening to Next Steps for Seniors, Conversations on Aging. Welcome back to Next Steps for Seniors, Conversations on Aging. My guest today in the studio is Frank Dubois, and he is French, in case you didn't pick that up in the first segment. But what a fascinating topic we have today. It has just been so insightful. Genesight medication management. We talk about what, why, and how this is helping you. So what I wanted to know, if for those skeptics out there, has Genesight been clinically validated?
Absolutely, Wendy. That's a great question. What the company has done from early on, we have 8 clinicals that have been performed. In fact, the last clinical was called the Guided Trial. It was authored by the University of Michigan Depression Center. So it's kind of neat to have something here in the backyard. And they looked at 60 different clinics nationwide in the treatment of depression and anxiety, and the results showed significant increases in the rates of efficacy. So that has been substantial, and what that is for is actually to offer that data to the payer market community. So the Blue Crosses, the Priority Healths of the world, to say, hey, look at the value of covering Genesight, and we received approval on the Medicare Medicaid platform years ago because of a similar trial that was run by the Medco Corporation and increases in efficacy.
So those people who are listening to the program that are not 65 and older and not on Medicare or Medicaid, tell us how the insurance companies work or the private pay component of it.
Sure. Yeah, what happens is we look at everybody as covered. So no matter what your insurance decides to pay on the billing for Genesight, the maximum out-of-pocket cost for that individual, even an uninsured person, would be $330 for testing, and that's a one and done. You just test once in life. Any upgrades that we do in the future are typically free, and that $330 can also be split into 12 interest-free payments if that patient selects to split it up on interest-free payment charge.
So it's reasonable, and it's so worth it. We are spending so much money on our medications.
Absolutely.
That if one test could make the difference in the meds that you're taking, and then you have a significant savings cost-wise, unbeknownst to all the health benefits, right?
Absolutely, yeah. If you find a better answer sooner, that the patient can sometimes reduce. We see this a lot in the nursing home situation as well. If they can reduce it, if they can take this load from 12 medicines down to 8 and feel better, that's a much better path because all that medicine is taxing in the body. Everything has to be absorbed and excreted through the liver kidney system, and these are the types of things. And you don't want that person as well to be snowed by too much medication in a polypharmacy situation.
How long do the results take to get back?
Results come back very quickly. We're running between 3 and 4 days out of our lab in Ohio. So the doctor has the results back in their hand very, very quickly to help make a more informed decision. So
let's talk a little bit about like a story, because I know that there are situations that you have seen a change specifically in people's lives.
Absolutely. Yeah, there's a great one I was just involved with in Saginaw, Michigan. It was a long-term care facility, and they decided they were going to swab about just over 50 of their residents. And so when I was talking to the team, the MA was setting up the swabbing. they said, well, we're going to have to do this early in the mornings. We have several cases of sundowning. Sundowning is something where people, the facilities see behaviors happen later in the evening hours as the sun's going down. And what was happening, one of the female residents, she was on 10 milligrams of Lexapro first thing in the morning for anxiety. And she was good all day long, but from that 4 to 6 p.m., she would start lashing out, screaming, crying, had bit somebody. Anxiety, it's full tilt. And so when the test result came back, I was talking to the nurse practitioner, and she said, this is interesting. She said she is ultra-rapid metabolizing for Lexapro. So she said, it's not the sun going down in the afternoon. She's simply probably out of medicine. In other words, the medicine for an ultra-rapid person, ultra-rapid metabolizer, goes into the body quickly and excretes quickly. So you just run yourself out of medicine. She put her on 10 milligrams BID or twice a day. The woman felt great 24/7. So
Unbelievable.
It was that simple. Once they knew the metabolism rate based on the test result, they knew the answer. The answer was right in front of them.
So we are trying right now with Genesight, from what I understand. We're in doctors' offices, we're in communities, we're in long-term care facilities. But what if someone listening to the program right now is like, I just want to ask my doctor about this. What do you recommend the best way to do this with their physicians? I
think you deserve the right for your best treatment possible. So I would ask that doctor. I said, hey, I heard about this, whether it be the radio or I was just on this website, genesight.com. There's an avenue here to find better answers for me, Dr. Smith. This will let you know what the best medicine, based on my body structure, will match performance and dosing strategy in a one-and-done test. Why wouldn't I want this answer instead of all the trial and error involved with this class of medications?
Do you feel like doctors have been open to this Genesight?
I feel like the ball is rolling. But over this, to give an example, like I speak to a lot of the university, like the nurse practitioner programs. I just spoke to Saginaw Valley State's program about a month ago. These MPs coming out of school, Wendy, they feel like this test should be run yesterday. Like, why wouldn't this just be part of the protocol being done? And I honestly hope in that 30, 40, 50-year span, I hope this is something, honestly, that's done at birth. Like, why wouldn't you want a personal medication profile leaving the hospital?
With a swab.
Exactly.
That's all it is.
Yeah, I think this will be something that is looked at later on as this is just part of the treatment and knowledge regimen that is already at our fingertips.
Well, and we learn and we grow as we age and mature, and our state, our country is very smart about things, but it does take us. Sometimes it's a slow-moving dinosaur.
Oh, no doubt about it.
Oh, geez, we didn't know this would happen.
It took the thermometer 50 years to hit the mainstream because they had another system in place, the hand on the head.
Just saying. I mean, this is what we're going. I mean, so here we are talking about Genesight testing, and so it's fantastic. I'm very grateful for you. There is, if you can remind us, there is a direct-to-patient kit.
There is.
If you're good at following directions, if you can see well, read the fine print, you can't just open the package and try to figure this out, right?
Right. Yeah, the package is well done. We actually initiated this program during COVID, and we call it DTP, or direct-to-patient. So that's a swab kit that would be sent to the person's residence. You follow the instructions. You can have, of course, a family member help you if you'd like, and then that's returned via FedEx. The other option, of course, is the offices all have test kits available. You would just stop by on your next visit and go ahead and have them do the swab, and then the office handles everything. So it's really two great options to get this done. And like I said, it's just done once, with the exception of a liver transplant. This is a one and done. You don't do it again in your lifetime, and you have nearly 70 medications worth of data at your fingertips.
Covered under Medicare.
Yes.
So, I mean, and why not? And the most it'll be is $330.
Yes, and that's the most if it's a commercial plan. Medicaid also covers it fully, so it does not get much better than to have this performed and have it at your fingertips for medication decisions the rest of your life.
During the break, you told me a quick story about a gentleman that was on a medication.
Yes.
Share that story with our listeners.
Yeah, there was another case where I was involved with where this gentleman is in a nursing home facility as well, but he was on a antidepressant or anti-anxiety medication. His wife was coming in daily with their golden retriever, and they would come in and visit. As she would leave, he still knew she was leaving for the day, so he would bang on the door for an hour, like 60 to 90 minutes, just bang on that. So it was causing a lot of disruption with the other residents, with the staff. Like, oh my gosh, he's banging on the door again. So they decided to use an anti-anxiety med. The one that was selected, he had not done Genesight yet. The one that was selected was so sedating, he wound up, it was already somebody who was quite frail, but he wound up losing like 8 pounds the first month. He was sleeping through breakfast, sleeping through lunch sometimes, skipping meals, and a person that shouldn't be skipping a meal. So they wound up, we had initiated a Genesight test with the nurse practitioner. She got the results back, and sure enough, that was in his red bin. Again, the bins are like green, yellow, and red. Red has a significant amount of gene-to-drug interaction. They moved him over to a green bin selection, same class of medicines, just a cleaner option for him. And he was, back up at 7:30 in the morning, eating breakfast, eating lunch, back to life. So it was one of those cases where it's like, wow. I remember flying back after that case made itself present, and I'm thinking, man, these folks need some help with medication and dosing decisions.
And he's not banging on the door for an hour anymore.
No, stop the whole banging, and she could come in and visit still daily, and
with
it just
the dog.
leveled the amount of anxiety, but didn't affect. Because sometimes a lot of these medicines are used as to treat other side effects. So you just all of a sudden that's another pill on the stack of medicines that aren't necessary in the first place if good informed decisions were made.
So when you're looking at your loved ones, and this is just to our listeners right now, when you're thinking of the people that you know and love, and you're seeing side effects or symptoms or things that sound a little suspect, right? Mm-hmm. Why not try Genesight testing? Maybe it is an interaction from one of those medications or a symptom or side effect.
Absolutely.
And you have nothing to lose and everything. You have $330, to lose.
Yeah, and if it's a facility-based test, like I said, Medicare Part B and Medicaid cover it fully. So that's one of the neat things about this particular space in long-term care is it's never a charge.
So again, Frank Dubois.
Yes.
And best way to get a hold of Genesight is?
Genesight.com would be a great place to start for either clinicians or patients. And that's our site. There's testimonials on the site. There's descriptions of what the test looks like. It's a great resource to educate yourself or a loved one, family member, friend, neighbor, whoever needs help down this path. It's a great start.
And you can subscribe and share this podcast program because other people need to know about this. So thank you for being here, Frank.
Thank you so much,
appreciate
Wendy.
what you do every day. We are so grateful for Genesight.